Hey, everybody out there, this is Dr. Ryan Clelland, and we're just so happy that you could come with us today on this webinar. We're going to talk about a an extremely serious condition that is plaguing our nation, that's plaguing pretty much, I'd say, half of the people over the age of 60 and probably a quarter of the people over the age of 40. It is peripheral neuropathy, burning sensation, numbness, tingling of the toes, feet, potentially the fingertips, the hands. And this is something that's becoming extremely severe. And we're seeing it more and more with all of our patients, or not all of our, but many of our patients. And we're excited because we have an option for people that is a non-drug approach that actually helps people get better and helps them heal from the inside out. And so we're extremely excited. We've been working on this for a long period of time, and we're actually able to even incorporate this within an insurance model. So that's even more exciting, so that we can give this treatment of the burning and the tingling and the numbness and the pain within those feet and hands. We can give folks the care that they deserve and the care that they need to get that power back, to get that energy, to get that sensation back, so they can start feeling young again, start feeling like they used to, hopefully walk better and experience life better. And like I said, we're just extremely excited to be able to offer this. So we're going to jump right in. I don't want to just talk just about what we're doing here. I'm Dr. Ryan Clelland, and we practice in Glen Carbon, Illinois at Infinite Wellness Integrative Medical. And in our practice, we're an integrative model, and so we actually have medical providers in here. We have a medical doctor, nurse practitioner, chiropractors, rehab, etc. And we're really just we take that approach with every single patient, and that's why we get the phenomenal results that we do. We're not just a multidisciplinary clinic where one doesn't help the other and it's just kind of everybody's an island. We at our office, we talk about every single patient as a group. We figure out what are going to be the best options, and we are constantly learning and constantly trying to figure out what we can do to ultimately make our patients and hopefully potentially your life better. And if you're dealing with this type of issue, or you think you might be in the right place. So we're going to jump right in. So, are you experiencing numbness? Are you experiencing burning, hand pain, back pain, joint pain in general? Because a lot of times when we get this peripheral pain, we also experience hip, low back, knees potentially, etc. And so, one chronic problem usually means someone has 2 or 3 chronic problems. We see that a lot with our patients. So if you're experiencing any of these, there are things that we can do in this practice. We're going to talk about, obviously, neuropathy today. What are the 7 common warning signs? Well, you see them here, and pardon my picture here. I'll move it to the other side. Maybe that'll be a little better. But so you can see numbness, burning, cramping, sharp electrical pain, prickling, tingling, balance problems, and falls, which is a huge one, especially as we age. And a lot of folks can't even sleep. It's just that the sheets on their feet just drive them nuts, just that feeling. So these are signs that you may be dealing with this. So what is peripheral neuropathy? It is damage to or a disease affecting your nerves. Okay, and so that's it. Your nerves are damaged. There are things that what do we need to be doing to heal the nerves? And so that's what we're going to be talking about today. And those are the things that we do in our office to heal your body, not just to cover up symptoms. Because what do we most commonly treat these problems with, at least in standard medical approach? We use drugs. And we all know that drugs are there designed to what? Cover up the symptoms, not to heal our body or help our body heal. So things like Neurontin or gabapentin, these are anti-seizure medications. So what you have to understand is these do not affect, let's say you have neuropathy of the feet. Let's say you have burning, numbness, tingling of the feet. These drugs don't affect the feet. These drugs actually affect your central nervous system, your brain, your perception of those types of sensations, not the sensation themselves. It doesn't affect the nerve that's being damaged. It affects up here and covers up that symptom up here. Now, I'm not saying these are bad or good. This is what they do. Lyrica, same thing. So many people have tried one, if not both. Many patients that we get in our office do not handle these drugs well. They actually show physically the side effects that all drugs have, because they are chemicals. They do not generate health, unfortunately. And so we have to understand that even if we are taking these, the problem, this is a chronic issue, this problem isn't getting better, right? And so if you're having some of these symptoms, some of these that are going on, that's your body's alarm system, right? Your body is telling you something's going wrong here. And instead of just turning off that little piece of, that little switch in our brain that senses that type of thing, we have to understand that we may be dealing with a chronic issue here. But what I want you to understand is you're not alone. Okay, this is not, or it's not just a couple people. This is drastically growing. This type of issue is drastically growing throughout the United States. 8% right now, the population, about 20, and this is in 2012, this study was done. 24 million people. I can guarantee you this is drastically increased. I mean, this is a pretty long duration. This is just the research that we got for this, but 30% of these diagnoses are linked to blood sugar handling. Now, just because you think you don't have diabetes does not mean that you don't have a sugar handling issue. You can have perfect blood sugar, perfect HbA1c, and yet there's still, because again, we have to remember that's why it works in the periphery first. It doesn't always, it doesn't start in the central area in our trunk. It starts in the periphery because we have less oxygenation. And so with less oxygenation, potentially less blood flow, so things like cardiovascular disease, all of these things can potentially play a role in damaging the nerve. And so you can see here, it's like a household cord, right? These nerves are designed to carry a signal. And so when that sheath around that nerve starts to deteriorate, break down, it's not functioning properly, we're going to have what? We could potentially have a fire. We could have short circuiting, like the shocks or that electrical feeling. So these are the things that we have to understand. So what can we do to heal this? So first of all, what is even causing this? And so some of the top causes that we talked about: sugar handling, prediabetes. Understand we're all pre-diabetic, right? If you don't have diabetes, sometimes in medicine they look at it like we're looked at like we have pre-diabetes, like we have pre-death, right? And so, in all joking aside, but poor circulation, microcirculation, because you got to understand, again, these are the distal parts far away from the heart. So, that blood has less and less oxygen the further away it gets from the heart. So that could potentially be a major issue. Toxic exposure. So we see a lot of chemotherapy-induced neuropathies. These are pretty tough. We can help them, but they sometimes take a long time. Back problems, because the nerves are being impinged upon or inflamed or sometimes even pinched. And so you could get neuropathy from back issues as well. Autoimmune, viruses, alcohol abuse, because again, blood sugar handling, liver disease, kidneys, etc. And then also too, there's a lot of medications out there that can cause these type of problems. So how does this happen? Well, really you have two different types of axons. Okay, we have the muscle spindle. These are the big ones. These are the 1As and the 1Bs. These are what fires the muscle. Okay, these fire the muscle, and so when that sheath or that coating around the nerve doesn't work anymore, then we're at risk for the inability to walk. We have muscle weakness, etc. And so we don't want folks out there falling. This is a huge problem for us as we age. Most of us know that if we fall as we age, there's a higher risk of risk of death, basically. And so we want to make sure that we're walking healthy, that our muscles work and they fire properly. Also, too, you have more of your A, B, and C, class 3 and 4 nerve fibers. These are the ones that are going to be that sensation, right? That light touch, temperature, etc. So you can imagine when you start getting short circuits in those, you can't feel your feet, you can't feel, you're getting numbness, tingling, you're getting burning. Why is that a big deal? You can't feel your foot, you can't feel your hand, you stub your toe, and down the road you could potentially be looking at amputation. And I know that's a big jump, but you have to understand this is a chronic issue. This isn't something that you take this pill, you don't feel it, and nothing's happening. This is something where it will get worse no matter what drug you're taking, unless you're trying to get your body healing. And again, that's what we do. That's what we're working towards, right? All of the things that we're working towards here is to help your body stimulate the healing process. So what are your choices? All right, you're sitting here and you're like, oh my gosh, these are things that I'm dealing with. What are my choices? We've already talked about the medications and why ultimately long-term that may not be the right solution. Now, again, it may help with symptomatology for a short time, but and then, other than that, many of us are told, there's nothing we can be done, right? Take the medication. There's no other options. Lyrica, gabapentin, Neurontin, these are what we do. But the good news is that nerves do heal. Now, this is proven as long as you have the right and you're going about it the right way. So peripheral nerves can heal. That damage around that cord can heal. So what are we going to do about it? How do we get that going? So the 4 steps to getting these nerves working better is, one, we have to increase blood flow. We have to stimulate blood flow to the extremity. Let's just use the foot as an example. We got to increase blood flow to the extremity. And so we have methodologies here that we can actually stimulate your own body's ability to pump blood through its system, which is exciting because the more blood you get there, the more nutrients you get there. And the more nutrients and the more oxygen you get down to your distal, that's going to create healing. All right. Also, too, we want to stimulate the nerves. We want these nerves being stimulated. We want to increase proprioception. It's just a long word for stimulation of the nerves. We want to get those nerves going again, right? We want to get those nerves firing again. We want to wake them up because they have been, many times they'll be dormant, and we want to wake those up. We want to activate those through therapies. We want to stimulate not only the proprioception, which is the sensation and kinesthetic awareness, basically you know where things are, but also too we want to stimulate their ability to fire, right? We want those nerves firing again. And so we have ways to basically stimulate that and to get the nerves firing, and then we want to decrease inflammation, right? We want to decrease the inflammation so that healing can occur, so we can put out that inflammatory fire while we're getting healing to occur. So imagine any of these, right? Whatever this could potentially be doing to you now, or if it's minor, be doing to you in the future, some of these symptomatologies that we talked about, but you're walking better, you're feeling better, this isn't keeping you up at night. I mean, and this is a real possibility, and it doesn't have to just be through chemical and toxic exposure of medications, because again, those are just masking the symptoms in the central nervous system. So if you have one of these symptoms, if you have one of the symptoms that we talked about today, and again, and you're wanting to feel better, we want to increase that blood flow. We want to stimulate those nerves. We want to activate those nerves, and then we want to decrease the inflammation. If we can do this for you, and it just takes time depending upon the severity. So the sooner you get in front of this, the faster that this is going to heal. If it's only just a little bit in your toes right now, jump into this, and you can get this knocked out so much quicker than if you can't feel your feet at all and it's completely affecting your gait. That's a much longer process. Maybe even a more expensive process, because it's just there's just so much that will need to be done. But these 4 steps can help your body feel better. So what are your next steps? If you're in this and you want to get better, now I want you to understand, now what we're talking about is not for everybody. There are things that you need to do. There are things that you may have to come in here on a regular basis. And we'll explain what that means. It's couple 2, maybe even 3 times a week sometimes, depending upon severity, maybe even 4. But what are your steps? First, you need to reserve a spot to come in and talk with us, to reserve a consultation. This is where we sit down, we talk with you either on the phone or in person, depends on what works best for you, what you're comfortable with, but we're happy to do them over the phone or in person. And then we help to talk through to see if you're even a good candidate about what we're doing, with what we're doing. If you are, then we recommend you come in, see our nurse practitioner, our medical team, and we see how bad it is. We're able to grade it, and we're able to see what we need to do to get you better. And then, because ultimately we want to make sure that if we accept you in our office as a patient, that we're able to get good results for you. And also too, it allows us to check your insurances, etc. But like I said, Medicare, private insurances are helping to cover some of these. Some of the therapies that we're doing here as a practice to help you get better, to help you heal from this. And that's our ultimate goal. So if you're serious about getting better, if you're willing to make a commitment to your health, and again, this may not be right for you right now, we're always here for you down the road if this is something that you want to do. But if you're ready to take advantage of what we know and what we're able to do for you, give us like I said, reserve your consult time via email, or you can give us a call. But please take advantage of this. This is vital. Getting better is not going to happen on accident. And this is just our practice information here. We're in Glen Carbon, Illinois. Like I said, my name is Dr. Ryan Clellan, our nurse practitioner. Nurse Talisha and Dawn and Dr. Andy and all of our team here. We are here to help you get better. We are here to help you heal. We are here to just help you throughout whatever you're dealing with. So if you're experiencing these things, please give us reach out to us. You can give us a call. We'll have the number after this. This is our office number, but we also have a direct line that you'll see that you can click on and it'll call us directly. But we just hope and pray that whether it's in our office or somewhere, that you find the answers you're looking for, that you get better and you start reaching out for things that are going to help your body heal from this type of issue versus only just covering up the symptoms. God bless you all. We hope to hear from you when you're ready, and take care.